Hi, my fellow HIT 165 past pharmacology classmates and other allied health students. My name is Yeram Cha. Thank you so much for coming today for the presentation to learn about the hepatitis B. One of the topics that I authored on the clean notes is hepatitis B, and I wanted to give an educational presentation explaining about what hepatitis B is to all of you. So let's begin. Here is a quick agenda of what we are going to cover today about the hepatitis B. First, we are going to learn about the definition of hepatitis B, including the description and etiology, signs and symptoms, treatments, medications, lab diagnostic tests for the hepatitis B, and some of the ICD-10-CM codes and coding considerations. There are 3 learning objectives for these presentations. By the end of this presentation, you will be able to define what hepatitis B is, describe at least 3 signs and symptoms of hepatitis B, explain at least 2 lab diagnostic tests for hepatitis B. So let's first look at the definition of hepatitis B. Hepatitis B is a liver infection that causes inflammation which can lead to liver damage. If it gets worse, it can lead to liver cancer and even death. The acute hepatitis B happens when you first get infected with hepatitis B. If treated, people may be cleared with the virus from the body and recover. And it can be prevented by getting hepatitis B vaccines ahead. With this map, I wanted to show about which region have a higher rates of hepatitis B. This map is from the CDC, which shows the worldwide rates of chronic hepatitis B. As you can see, there are high rates of chronic hepatitis B in Asia, Pacific Islands, and Africa. See the areas of the Asia, Africa, and Pacific Islands have a darker green colors, which have the higher chronic hepatitis B infections. Moving on to the etiology of the hepatitis B. The cause of the hepatitis B infection is HBV, which is hepatitis B virus. The virus can be spread from person to person through blood, body fluids, and semen. However, sharing food, sneezing, or coughing does not pass virus from person to person. In addition, sharing of needles, sexual contact, accidental needle sticks, and mother to child while delivering a child would spread the hepatitis B virus. Let's look at the signs and symptoms of the hepatitis B. There are several signs and symptoms, which includes abdominal pain, fever, dark urine, loss of appetite, nausea and vomiting, joint pain, weakness and fatigue, jaundice, which is a yellowing of the skin, and whites of the eyes. You can easily detect if a person have a jaundice or not by looking at their face, because if they have jaundice, their face color, the skin color tone would be really yellow, so you can easily see if he or she has a jaundice. Treatment of hepatitis B. There are main 3 treatments of the hepatitis B. The first one is injection of an antibody, which can be given within 12 hours of exposing to hepatitis B virus that may protect a person to get sick. The second one is the interferon injections of the interferon alpha 2B. This is one of the other injections that people can get. And then if the liver keeps get damaged, people with hepatitis B would have to get the liver transplant. Moving on to the medications of hepatitis B. There are in 5 antiviral medications that patients could be prescribed by the doctors, which are entecavir, tenofovir, lamivudine, adefovir, and telbivudine. There are 3 main labs diagnostic tests for hepatitis B. First, and in order to detect and check if a person has a hepatitis B virus in their body, they can get the blood test. This is the most easy lab testings that people can get. First, they can get the liver enzyme blood test, or hepatitis B surface antigen, or hepatitis B surface antibody blood test. They can also get the abdominal ultrasounds by looking at the liver and then see what kind of status that the liver is right now to detect hepatitis B. If person has a severe hepatitis B virus infections, that it can be detected from the ultrasounds. If something is found in the ultrasounds and then the person needs a biopsy, the liver biopsy will tell something that are found from the biopsy, if that is malignant or benign. Let's look at the ICD-10-CM codes for the hepatitis B. Mainly there are the codes that includes from the ICD-10-CM are B16-, B18.9, B18.1, B19.10, and B19.11. I wanted to quickly go over the codes for the hepatitis B. So when you open the ICD-10-CM code book, in the index term search, you can type hepatitis, comma, and B, and it will show up the hepatitis B codes, which is B19.10. Then you can click this one, and then the sides it tells you about what this code is. So B19.10 is unspecified viral hepatitis B without heptic coma. And then B1911, which we can also use as unspecified viral hepatitis B with the heptic coma. With all of these codes listed right here, hepatitis B is classified as acute chronic with or without delta agent, with or without hepatic coma. Here is the summary for the hepatitis B presentation. Here is a summary of this presentation. Hepatitis B is a liver infection. Hepatitis B virus causes inflammation that led to a liver damage, and it can spread from person to person through blood, body fluid, semen, needle sharing, sexual contact, accidental needle sticks, and mother-to-child spread. The signs and symptoms include a fever, abdominal pain, dark urine, nausea, vomiting, weakness, fatigue, and jaundice. The treatments and medication for the Hep B includes the injections of antibody, which can be given within 12 hours of exposing to the virus, and in the worst case, the patient might have to get the liver transplant. Patient also can get the antiviral medications to manage the symptoms and to slow down the progress. The lab and diagnostic tests include a blood test, abdominal ultrasounds, and the liver biopsy. This is the end of the presentation. Once again, thank you so much for coming for this presentation, and I hope you were able to learn about hepatitis B and some of the hepatitis B coding consideration. If you have any question, do not hesitate to reach out to me via my email, or you can ask any questions regarding to these presentations. And here are some references that I have used for these presentations. If you need any additional references, I am more than happy to share the references, so please let me know. Thank you.